In the United States, someone has a stroke every 40 seconds. Every single minute that a stroke goes untreated, approximately 1.9 million brain cells die. Not slow damage, not gradual decline. Active, irreversible loss of the tissue that controls your movement, your speech, your memory, your ability to recognize the faces of the people you love. And yet the statistic that should concern every person watching this video right now is a different one entirely. According to the American Stroke Association, a transient ischemic attack, what many people call a mini-stroke, precedes approximately 15% of all major strokes. It is the body's most direct, most urgent warning that something is about to go catastrophically wrong in the brain. And research shows that nearly 1/3 of people who experience a transient ischemic attack go on to have a full stroke within 1 year. Many of them within 48 hours. The warning arrives, and most people do not recognize it. They feel dizzy and sit down. They notice something strange in their vision and assume they need new glasses. One side of their face tingles briefly, and they blame it on sleeping position. The symptoms pass within minutes. They feel fine. They move on, and then the full stroke comes. Today, we go through exactly what the 24 hours before a stroke can look like. Not the dramatic, unmistakable moment of a full stroke, but the quieter signals that arrive beforehand. The ones that disappear and are dismissed. The ones that neurologists and stroke researchers have documented as some of the most critical warning windows in all of medicine. And the one number you need to carry with you every day, because it defines the difference between full recovery and permanent disability. This channel is built on one commitment: taking published medical research and delivering it in plain language for adults who deserve accurate, clear health information. Subscribe so you never miss a new video. We upload daily because your health does not take days off. And if someone in your life is over 50 with any history of high blood pressure, heart disease, or diabetes, share this video with them before you finish watching it. What we're covering today is that important. Let's begin. Before we go through the specific warning signs, you need to understand one concept, because without it, what follows will not carry its full weight. A transient ischemic attack is not a mild stroke. It is not a smaller version of a stroke. It is the brain sending an emergency signal that blood flow to a critical region was temporarily interrupted, and that the conditions causing that interruption are still present. Here is the mechanism in plain language. The vast majority of strokes, nearly 87%, are ischemic. That means they are caused by a clot blocking blood flow to part of the brain. The clot does not usually appear from nowhere. It builds. Plaques accumulate in the walls of blood vessels over years. Portions of those plaques can break off. Clots can form around irregular heart rhythms like atrial fibrillation and travel to the brain. In a transient ischemic attack, a clot temporarily blocks blood flow and then dissolves or moves before permanent damage is done. The symptoms appear. Then they resolve, sometimes within minutes. The person feels fine, but the artery where that event occurred is still narrowed. The plaque is still there. The underlying condition, whether it is uncontrolled blood pressure, atrial fibrillation, or arterial disease, has not changed. The same mechanism that produced the warning event is still fully capable of producing the full event. The American Stroke Association states directly, a transient ischemic attack is a warning stroke, and stroke rates in the United States double every 10 years after the age of 55. The window between the warning and the full stroke is not always measured in months. Research confirms the highest risk period is within the first 48 hours. This is why recognition matters more than almost anything else in stroke medicine. The first warning the body sends is one of the most commonly dismissed: sudden, unexplained dizziness, a feeling that the room has shifted, balance that feels briefly unreliable, the sense that your body is not quite responding the way it should when you stand or turn. Most people over 50 experience occasional dizziness and connect it to dehydration, standing up too quickly, blood pressure medication, or inner ear issues. And often, that is exactly what it is. But there is a specific quality to stroke-related dizziness that is different. It arrives suddenly, without any obvious trigger. It may be accompanied by a simultaneous feeling of unsteadiness, a loss of coordination in the legs that makes walking feel briefly uncertain. The Center for Disease Control lists sudden trouble walking, sudden dizziness, and sudden loss of balance or coordination as major warning signs of stroke. The key word in every stroke warning sign is sudden, not a gradual feeling that built over the day. Sudden, as if a switch was thrown. When sudden dizziness arrives alongside any other symptom on this list, even if both symptoms resolve within minutes, that combination is a medical emergency regardless of how normal you feel afterward. The second warning is one that tens of millions of adults over 50 have already experienced and attributed to aging eyes or stress. Sudden vision changes, not blurry vision that gradually worsens over weeks. Not the need for stronger reading glasses. Sudden changes in one eye or both. A portion of a visual field that goes dark or dims briefly. Double vision that appears without explanation. The sensation that something like a curtain or shade is being pulled across part of the visual field. Memphis neurology clinicians describe this specifically. A stroke can block blood flow to the areas of the brain that process visual information. The visual change may be temporary. It may last only seconds. And because it resolves, people convince themselves it was nothing, a flicker, a trick of the light, fatigue. Health experts documenting early stroke signs note that many adults over 50 mistakenly blame these brief visual disturbances on aging eyes or an outdated eyeglass prescription. That delayed recognition, that specific dismissal, is one of the most costly diagnostic delays in stroke medicine. If your vision changes suddenly and without explanation, even briefly, and especially if it involves only one eye or only one side of your visual field, that is the brain reporting a vascular event. It should be evaluated that day. The third warning is the one with the most documented pre-stroke evidence in the research literature. A headache that is different from any headache you have had before. Published research from a peer-reviewed study in PMC journals examined 550 stroke patients and found that 14.7% of them experienced what researchers call a sentinel headache, a new type of headache or a familiar headache with dramatically different characteristics in the 7 days before their stroke occurred. In the same study, among healthy controls, only one person in the comparison group reported a similar headache pattern. The statistical difference was significant. A sentinel headache is not described as the worst pain of someone's life, the way a ruptured brain aneurysm is characterized. It is described differently. A headache that feels wrong. A headache that arrives suddenly with no typical trigger. A headache that does not respond to the pain reliever that usually works. A previous headache type that has suddenly changed in character, more intense, more frequent, or arriving in a different location than usual. Dignity Health's published clinical guidance notes that one study found 15% of people who had an ischemic stroke reported an unusual headache beginning within 7 days of the stroke. These sentinel headaches were more prevalent in people with atrial fibrillation, an irregular heart rhythm that significantly increases stroke risk. This is important because atrial fibrillation affects an estimated 6 million Americans, with prevalence rising sharply after the age of 65. Many of them are on blood thinners specifically to prevent the clot formation that causes stroke. A sentinel headache in someone with atrial fibrillation or any known cardiovascular risk factor is a symptom that warrants same-day evaluation. The fourth warning is the one most people know in theory and still dismiss when it actually happens to them. Sudden numbness or weakness on one side of the body. Not the kind of numbness you feel in a foot that fell asleep after sitting too long. Not muscle soreness from activity. Sudden numbness or weakness in the face, the arm, or the leg, particularly when it involves one side of the body more than the other. Northwestern Medicine Stroke Center lists this as one of the primary pre-stroke warning signs. When a clot temporarily reduces blood flow to the motor or sensory cortex, the brain regions that process physical sensation and control voluntary movement. The signal traveling between brain and body is disrupted. The arm feels weak. The face droops slightly or feels numb. The leg doesn't respond with its usual strength. What makes this warning so frequently dismissed is that it resolves. In a transient ischemic attack, blood flow is restored before permanent damage is done. The weakness passes. The numbness fades. The person moves their arm normally and concludes that nothing happened. But the event was real. The brain was deprived of blood flow. And the underlying cause of that deprivation has not been corrected by the resolution of symptoms. Memphis neurology clinicians explain the mechanism precisely. The stroke interrupts nerve signals between the brain and the body. It might start as a mild feeling, but it can quickly worsen. And across the research literature on transient ischemic attacks, the clinical consensus is uniform. Neurological symptoms that resolve are not less serious. They are warning signals of a potentially imminent full event. The fifth warning is the one that travels most quietly through daily life. Sudden confusion. A word that won't come. A sentence that doesn't form the way it should. Speech that feels momentarily tangled. The experience of knowing exactly what you want to say, but finding the words momentarily inaccessible. Or the reverse. Hearing someone speak and having their words feel briefly strange, as though your comprehension has slipped for a moment. In a full stroke, speech disruption is dramatic and unmistakable. In the warning phase, it is subtle. It passes. The person finds the word a moment later and moves on. They chalk it up to fatigue, distraction, or simply a senior moment. Blue Cross Blue Shield's clinical guidance documents sudden confusion and difficulty speaking or understanding speech as major stroke warning signs, alongside the more visually obvious face drooping and arm weakness. The American Stroke Association's BE-FAST acronym specifically includes speech difficulty as one of the 5 cardinal warning signs that should prompt an immediate call to emergency services. The reason sudden speech disruption is so significant is anatomical. The brain regions that control language are among the most functionally specific areas in the entire brain. Broca's area controls speech production. Wernicke's area controls language comprehension. Both are supplied by branches of the middle cerebral artery, one of the most common sites of ischemic stroke. When blood flow to either region is interrupted, even transiently, the result is precisely the experience described above. Words that won't come. Sentences that feel briefly disconnected. A momentary speech disruption that resolves completely is still a stroke warning, particularly when it occurs suddenly, without fatigue or alcohol or any other obvious explanation. Now we arrive at the number that defines everything else in this video. 4.5 hours. That is the treatment window for TPA, tissue plasminogen activator, the clot-busting medication that is the primary treatment for ischemic stroke. Research published by the American Heart Association and confirmed across multiple clinical trials shows that TPA most effectively dissolves the clot-blocking blood flow to the brain when it is administered within 4.5 hours of symptom onset. The greatest benefit is seen within the first 3 hours. What does that mean in terms of outcomes? Health Partners published data showing that for every minute the brain is deprived of blood flow during a stroke, approximately 1.9 million brain cells die. Beginning treatment just 15 minutes faster leads to measurably better outcomes, including 26 more patients per 1,000 who can walk independently at hospital discharge. And a 2025 clinical trial presented at the American Stroke Association's International Stroke Conference found that in patients treated with alteplase up to 24 hours after stroke symptoms first appeared, 40% had little to no disability at 90 days, compared to only 26% of those who received standard care. The window, in some circumstances, may be wider than previously understood, but that expanded window requires advanced brain imaging to identify salvageable tissue. It is not a reason to wait. It is a reason to arrive at a hospital as quickly as possible so that imaging can be done and the right decision can be made. Every minute matters, and the minutes you spend wondering whether to call for help are minutes the brain does not have to spare. Here is the framework that should travel with every person over 50 from this day forward. The BE-FAST acronym, documented and promoted by neurologists, stroke associations, and emergency medicine specialists across the country. Balance, sudden loss of balance or coordination that you cannot explain. Eyes, sudden vision changes in one or both eyes, even briefly. Face, ask the person to smile. Does one side droop or look uneven? Arms, ask the person to raise both arms. Does one drift downward? Speech, ask them to repeat a simple sentence. Is anything slurred or confused? Time, if any single one of these signs appears, call emergency services immediately. Do not wait to see if it resolves. Do not drive yourself to the hospital. Call. The research from the American Stroke Association is unambiguous on this point. Symptoms that resolve do not reduce the emergency. A transient ischemic attack is a medical emergency just like a full stroke. Every minute between symptom onset and treatment is brain tissue that either survives or does not. Your brain has been working without pause since the moment you were born. It has carried every thought you have ever had, every memory, every word you have spoken to the people you love. Every morning you have woken up and recognized where you are. A stroke does not announce itself with adequate warning, but sometimes, in the hours before the full event, it sends signals. Quiet signals. Signals that pass and are forgotten. Now you know what those signals look like. Now you know what they mean. And now you know exactly what to do when you see them, in yourself or in someone you care about. Do not wait to see if it passes. The 4.5-hour window does not restart. If this video gave you something important today, subscribe and share it. We upload new evidence-based health videos daily because this kind of information belongs in every household. And leave a comment below. Has someone you know experienced any of these warning signs? Your experience in the comments may be the thing that causes another person watching this to act in time. Take care of yourselves.